this is not another day at work. So this is actually my 10th time doing this with OpWalk. My first time with OpWalk Chicago, and my second time in Nepal.
This is my first medical mission trip, period.
So far this week's been an incredible experience. It's blown away all of the expectations I had.
Obviously, as an anesthesiologist, I'm intimately interacting with the surgeons every single day. But I think the difference here is going up to the floors, seeing the physical therapists up there, which is a part of medicine that I don't really ever see the families and seeing the patients getting up and walking, and it's very heartwarming. It's really gratifying.
Being able to provide these life-altering surgeries to these underserved people here has been just an outstanding experience and something that's life-changing.
You know, we do a lot of joints back home at our hospital in Skokie, and we have all of the most advanced technology available to do that. We're here now in Nepal. We have much more limited resources. From a training perspective, it's very valuable to learn how to do the same things in different places with different tools.
This never gets old. It never becomes mundane.
This has been very eye-opening. So anybody that's in my position, it's worth getting involved. Like I've gotten my exposure to this now, and I think I'm gonna wanna be a part of this in some degree for the rest of my career.
It's kind of life-changing. It's just amazing. I'm just so blessed to be able to have the ability to help these people.